of Global Surgery webinar series. This is the second season of the Global Surgery webinar series, and we have the first episode with Dr. Abhijit Lele and Dr. Atta Bhatti presenting a topic on neurosurgery and its global surgery perspective. I request Dr. Atta to share his screen and start the presentation. I request the viewers to keep their question and answers at the end of the session. We have a dedicated 15 minutes to discuss. Thank you.
Okay. Thank you, Dr. Preeti, for the invitation. Can you see my screen? Can you see my screen?
Yes, we can see your screen, yes.
Okay. So thank you so much for inviting me to introduce the importance of global neurosurgery and also my organizational introduction. So this is great to see the future of medical and neurosurgical fraternities in front of us and taking interest in neurosurgical work. So with the background of global health and global neurosurgery, I would like to mention an important landmark. In 2023, the World Health Organization achieved 75th year of determination and dream for health for all. But in fact, this dream is still a dream and it's a long way to go. As we all know that there are multiple social developmental goals, and these are the 17, mainly the SDG 3, which deals with the health directly, but there are indirect multiple components which are linked to the universal access or poverty or the complex world we live in, where the IT technology, different courses and education, the cost, and also a new dynamics of health are making the competition more bitter for 2/3 of the world. I mean, 70% of the people living in the lower and middle income countries, they are still deprived of the basic health facilities. So Lancet Health Commission in 2015 reported that 5 billion population still have no access for the emergency necessary surgical anesthesia and surgical procedures, which are basically life savings one. So myself, with the background of training and experience working as a neurosurgeon and later on as a neuro interventional specialist in my country, I have been through observing the difficulties. Since there is no proper health system available in majority of the country we are talking about, there is no insurance system. The health system at national levels are very weak. Elite class is only having those facilities, and those are also available in the capital cities of the world, those countries which are providing facilities in the private sector. And when we call patient as a customer and our services, so then the dynamics are totally changed into a new direction. And the conventional role of doctor in all that health ecosystem is becoming very weak. So based on all these backgrounds, contributing from my own perspective, making the voice of doctors and health practitioners more stronger in neuro healthcare for LMIC, addressing many issues like the health migration, the lack of supervision, facility, and voice in the system. and also there uh, are obvious gaps present in the system, which are beyond the scope of doctors to deal. So we made a small step, baby step to make the neuro healthcare for LMIC, which is based in Geneva, and the background is showing the headquarter, and it's on the front side of the Geneva, and we are taking a humble start to contribute from our side to a system where we could um, do certain things like providing the affordability, providing the holistic care, providing the comprehension uh, to common people, the awareness of the importance of neuro healthcare and how to provide benefits to the patient, the healthcare providers, and also the healthcare workers working in the difficult environment. Based on the personal experiences and the published experiences, we could see how the disparities there and health equity is missing. Also, the neuro healthcare amongst the health sector is also important because it's not the patient, it's the whole family which takes the burn. And once the um, winner of the family, bread earner of the family is involved, then all the family and in fact the society will goes into the more desperate, unproductive cycle and leading to poverty. So health is a basic right. So still, this is just on papers. Many people can not get the services for life-saving situations like extradural hematoma in a road traffic accident. Uh, Timely reporting in stroke cases. People have to go through thousands of kilometers just to see a neurosurgeon, and many are not fortunate enough to see because of the low resource system. And our mission was to address all those issues through providing connections and services, just like the utilization of telehealth services, diagnostic, operating, and neuro rehab education, equipment infrastructures, and also different activities, virtual and on ground, to improve the situation as much as we can. So there are many countries and many groups and many organizations with the similar goals are also in contact, involved, and in 2 years' time, we are growing in different areas. Obviously, it's a start, and we need more people to join us as volunteers, um, as contributors, as advisors to point out the individual difficulties people, society, and the segment of countries are facing through. So it's not necessary to have a health or paramedic background. Um, People with the neuroscience, especially the young generations, the biomedical side, which is important because a lot of equipments donated by the higher income countries become dumping ground if there is no mechanisms to make those equipments in a condition to keep benefiting the system and patients. Obviously, the IT, finance, and management is also some areas where there is a lot of need and requirements for people to contribute. So these background peoples are welcome to join us. And the new healthcare for LMIC, the way we work is to partner with the ministries, tertiary care setups, professional groups, industry, and society segments as well as the NGOs, as I mentioned. Uh, if you see the screen, my slide is showing the Olympic Lausanne, Switzerland track in the headquarter, where we see that this is track, and we know it's full of the challenges. It's full of unconventional blockages, unconventional paths. There are certain ill-defined areas. We acknowledge the groups working in the area of global neurosurgery in last 2 decades, and they are doing wonderful, but the needs are enormous. And we, by the time we provide some sort of services, the needs surpasses the efforts we done. So it um, shows the opportunity for the new generation to keep their future option open, contribute in neuro healthcare as their professional future career, at least part-time, if not the full-time. So, so we could provide the holistic care to all those who are still needing the basics. When we want something to be done, um, according to Brazilian Paulo Coelho, uh, all the universe conspires to help us achieve it. And we believe in our goal. We know the path is full of difficulties. We know that through the uh, crisis, we see opportunities. Our role is bridging the role, bridging the gaps, um, interacting, planning discussions, and starting the campaigns to uh, involve all the stakeholders. This is the website we have, and we try to keep sharing our experiences. It's with the name of Neuro Healthcare for LMIC, and I urge people, all the participants to go through the websites. And these are the few examples. More than 30 countries participation in our educational programs in last 2 years' time. We have many partnerships with different countries, with the different ministries. We run the programs. We have collaborations with the groups. We present and suggest our concepts on different forums, including Geneva Health Forum, which is one of the prestigious ones. We invite people to join us with the ideas so we could present it to the forums. So what we offer to the people who join us, it's a mentorship in the areas, individual counselings care regarding the career and opportunities, teaching training activities, and telehealth services from the perspective of patient and families. We know that the um, uh, faces will change by which we can benefit this cause. And currently, the areas which needs more attention are the fundraising, which is a challenge everywhere, especially in the circumstances the world is facing through nowadays. I summarize with this slide to ask people to contact us. We are here to let you know about more our next plans and the countries where people want the medical students and young generation wants to open the new chapters of our organizations. They are welcome to contact us, and we can grow together to make an impact and to become kindle for others to do similar things. Thank you so much for the attention. Over to you.
Thank you, Dr. Atta, for the wonderful presentation. And we hope the junior doctors would be collaborating with you in future and contributing to the growth and development of neuro healthcare in in the world as such. I request Dr. Abhijit Lele, the lead at External Ventricular Drainage Project, which is under the umbrella of Society of Neuroanesthesia and Critical Care United States. Dr. Abhijit, over to you, please.
Thank you so much, Dr. Samant, and let me share my screen here. Okay. First of all, I think it's a great honor for me to present today. What a noble cause here, and really good luck. And thank you, Dr. Bhatti, for your leadership in this particular initiative. And so, what I'm going to present today will probably appeal to you all in terms of kind of this global patient safety initiative called the EVD Safety Campaign from the Society for Neuroscience in Anesthesiology and Critical Care. I come from
I assume we have lost connection with Dr. Lele. Let's wait for 5 minutes. Till then, if any of the viewers have questions for Dr. Atta, please proceed.
If there is no question, then Dr. Bhatti can share the organizational work she's doing under this program till Dr. Lele joins us. That would be
That's a good way to go about it. So I currently co-chair the Global Surgery Working Group at World Medical Association Junior Doctors Network. We are a group of global surgery enthusiasts, junior doctors who want to work on advocacy and expansion of the global surgery work across low and middle income countries. Uh, Along with me, we have Dr. Ramita, who is based in Sri Lanka, is currently doing his fellowship in Baylor College of Houston in global surgery. The aim of this webinar series was to bring leaders and activists in global surgery domain who are pioneering with their work and bringing in change at regional and international levels. So after season one, we have had a very good response from viewers, audiences, and the kind of expertise we brought on the field uh, was noteworthy. In the same way, the season two aims to continue the same work along the line. I believe Dr. Abhijit is on board. So, Dr. Abhijit, welcome back.
Sorry, we had a big power outage here, so,
Yes, yes,
sorry about that.
not
Okay,
an
let me
issue
let
here.
me kick
So,
start again. Okay,
yes, please.
screen here. Okay, so as I was saying, let me go. Let me start from here. Okay, so the mission for SNAC is to safeguard and optimize perioperative neurological function and brain health through neuroscience research, education, advocacy, to advance high-quality patient-centered anesthesia in critical care. And the purpose of the EVD safety campaign is to enhance patient safety and quality in the care of the patient with external ventricular drains. And the primary objective of the campaign is to create and disseminate the EVD Knowledge Hub. The Knowledge Hub has 6 components to it. One is the EVD education video, which goes over all the nuts and bolts of insertion and maintenance of external ventricular drain, how to level zero the catheter transducer, how to manage the ICP, accuracy of monitoring the ICP, as well as reviewing the ICP waveforms. We also give access to the SNAC EVD guidelines that were published in 2017, as well as an accompanying SNAC educational document that can be downloaded and printed into laminated sheets that can be used for education purposes. We also have a SNAC EVD quiz that all healthcare professionals can take to update their knowledge with regards to the basics of EVD care. We also present and provide access to an EVD policy template, because what we've observed is that many of the hospitals lack a policy or a procedure when it comes to EVD insertion and maintenance, and having some sort of a guidance for nurses, for physicians, for nurse practitioners, and other professionals taking care of patients with EVD is important. So this policy template includes recommendations from SNAC as well as the Neurocritical Care Society. And lastly, we have the quality and safety quality metrics regarding EVD. Most importantly, I think we are promoting the use of intracranial pressure monitors during transport of patient with external ventricular drains. So as I mentioned here, the education document that was published along with the 2017 SNAC guidelines is a nice way for anybody that is interested in basic EVD education, as well as understanding EVDs in the moment when they are faced with a patient coming to the operating room, either from the ICU or from the emergency department with an external ventricular drain. The EVD quiz is something that I had put together many years ago as an educational module, which were implemented in 7 academic medical centers around the United States and in Finland. And so that quiz is now available to everybody as a part of the campaign. Just quickly going over the SNAC EVD guidelines. These guidelines were proposed for safe and quality of care for perioperative management of adult patients with external ventricular and lumbar drains. And they came around a year apart after the Neurocritical Society released guidelines with regards to best practices for reducing infection and hemorrhagic complications with external ventricular drains. So the guidelines contain information regarding the major indications for placement of EVDs, lumbar drains, complications associated with procedures, preoperative assessment of patients with these CSF divergent devices, and as I mentioned, how to recognize a normal and an abnormal ICP waveform, which is important for bedside care. We look into and provide information regarding the type of catheter, as well as the CSF collecting system that is commonly used in the United States. Of course, every institution around the world likely has a version that is similar or a little bit different than what I'm showing here. Maybe at your institution, you may have a different type of catheter, which is non-antimicrobial impregnated, or the CSF system may be something that is indigenously manufactured. We also provide a checklist that goes into details about preoperative assessment, transporting patients with EVD lumbar drains, as well as intraoperative management and troubleshooting in terms of sudden changes in either ICP or CSF or waveform differences with EVDs in the operating room. So this particular campaign and its deliverables can be accessed on the SNAC's website, and all the content is free of cost. So you don't have to pay anything to access the content. You don't have to pay anything to download the content. And so all the 6 particular type of the Knowledge Hub is for you to download at your leisure. In addition to SNAC, the Anesthesia Patient Safety Foundation also partnered with SNAC and has made this content available on their website, along with a podcast talking about external ventricular drain safety. The safety campaign was launched by SNAC in middle of 2023. So we are in our 2nd year of the campaign. As you can see, more than 50 hospitals for more than 30 countries have now participated in the campaign. As you can see, this campaign has really reached quite a few countries around the world, and it's not only limited to high-income countries, but a lot of low-middle-income countries and hospitals are participating in the campaign. The EVD quiz has been taken by more than 400 healthcare professionals, and you can see many of them are from low-middle-income countries. So this campaign has reached and across borders, if you will. The campaign has received excellent views, both on the SNAC website as well as the APSF website. The guidelines have been viewed and downloaded more than 600 times, as well as the video and the quiz, as you can see here in the quality metrics as well. So a plea to everybody who's on the call today and those who are joining remotely, let's work together to promote external ventricular quality and safety. And this is the link to the safety campaign. So the best thing you can do is to visit the website, visit the deliverables for the campaign, and send this link over to your colleagues in your hospital, your residents, your anesthesia, nurses, anesthesiologist, your ICU, nurses, neurosurgeons, neurologists, all the healthcare professionals that for patients with external ventricular drain will benefit immensely from this, from joining the campaign. And please continue to spread the message about EVD quality and safety through your platform. And thank you so much for having me on the call today. So.
Thank you, Dr. Abhijit. It was a wonderful presentation. And for your information, viewers, I have had the opportunity of doing the clinical audit on this project during my residency last year. And to explain the process, Dr. Abhijit and his team has been a wonderful, platform to work on the project and, get everything, the nitty-gritties in detail and execute it at ground root levels in the hospital. Even if you don't have any provisions or guidance, the team is already there, always there to guide you at every front. The room is available for question and answers if you have any. I request the audiences to please place their questions.
If I'm allowed to say something till we get the questions. Dr. Preeti. Can I comment, Dr. Preeti?
I have a question for Dr. Lele.
Sure.
In terms of global surgery, how would external ventricular drainage project be implemented, since EVDs are not much talked about or discussed about in terms of training in the residential period? So how would it be important aspect of surgical training, and what is the implication of global surgery to it?
I think the external ventricular drains are one of the commonest bedside neurosurgical procedure performed around the world, if you will. So I think something that many of our trainees, especially on the neurosurgery trainees, perform these cases on a routine basis in their first year of their neurosurgery training. And so it's vitally important that this particular pressure monitor and its insertion and maintenance practices with regards to infection prevention as well as hemorrhagic complication prevention, it becomes an extremely important quality and patient safety concern when it comes to ICP devices. And so I think for a young trainee or a trainee that is just starting their residency, whether it's surgery residency and especially neurosurgery residency, it's something that you may encounter routinely at your hospital. Mind you that every hospital is a bit different with regards to how many EVDs they place a year. For example, at Harborview, we place around 250 EVDs a year. We are a very large trauma center, as well as a very high stroke and a subarachnoid hemorrhage center as well. So your center, and I think Dr. Savan's center is an example that maybe a private teaching hospital may place around 12, maybe 20 EVDs a year. So I think it's vitally important that a procedure that is something that is placed in patients who are critically ill, right? These are patients with acute brain injury due to subarachnoid hemorrhage or intraparenchymal hemorrhage, intraventricular hemorrhage, or a ischemic stroke, or somebody with chronic hydrocephalus. who with a pre-existing ventriculoperitoneal shunt that is malfunctioned or infected, they need this as a life-saving procedure. So I think it's from that perspective, I think it's extremely important from a global surgical perspective that this is offered to all patients at the earliest in their golden hour of neurological neurosurgical emergency. And so, first of all, we need to be aware of that. And I think Dr. Bhatti alluded to the fact that getting to the hospital, getting to a neurosurgeon sometimes may be difficult for many of our patients. But I think our goal should be to get them to a place where this is a life-saving procedure in many regards and can help stabilize the patient for further neurosurgical procedures downstream. So I think I would say that EVDs by themselves being offering both diagnostic as well as therapeutic intervention in terms of CSF drainage offer a life-saving intervention for many of our surgical and neurological patients. So we should consider that as something that, as Dr. Bhatti mentioned, I would say every neurological emergency patient right to have that EVD placed as fast as possible, as safe as possible, with minimal complications. So.
Thank you, sir. That explains in plenty the importance of EVD and why we have brought the topic on board for discussion. Next question for both the speakers. What is the importance of AI and robotics in neurosurgery, and how can we implement remote technologies for neuro healthcare in remote areas?
Suppose it's very important and relevant question. But before answering this, I congratulate Professor Lele for his excellent work and spreading the very basic and fundamental of neurosurgery. So hydrodynamics, CSF flow, though a basic thing in life-saving situation to save brain by saving time, but it's still complex and it's still full of frustrations from the end of patient. When these few $1,000 things are not available, the environment is more prone to cause secondary problems like infections, and the neurosurgical resident trainees are not available, and systems have the best available surgical residents. So it becomes paramount important to avail the best available resources, like the general surgery residents should be trained in these life-saving procedures. The paradigm of treatment and saving time is pressing us not to wait for patient to reach to emergency rooms. Rather, the ambulance are well equipped with these life-saving procedures, because in a way, the time is the decisive factor. The place where people got the first treatment sometimes becomes a difference between the disabilities, the fatalities versus the good outcome. So the SNAC is, excellent work to deliver in time, to raise the importance of this basic life-saving procedures. One is the technicalities. Second is the guidelines, as Dr. Lele mentioned. So every step is important, and every one of us, even the residents of surgery or emergency or paramedics under supervised tele consultation based supervision, can save lives. And this should be known to every center and every corner of the world, that this is available free resource. And I would be glad to learn more from Dr. Lele for his work and the remote centers, so we could utilize the ongoing projects and contribute if we could. Now, coming back to technology, AI, robotics. Again, in higher income countries, in the developed worlds, the directions are very different. But lower middle income countries also have relevance, provided they have a good communication channels, the internet availability, the telehealth services and connections with the professionals like Dr. Lele is referring. So the communication loop can make the technology, artificial intelligence, and other complex things like robotic surgeries, robotic neurosurgeries, sitting far away to guide the primary surgeon to do the best things in the areas where the human hands and manual dexterity cannot deliver. So artificial intelligence providing us many solutions in terms of diagnostics to pick up the most relevant uh, patients to be treated, directing those emergencies like in disaster managements, what needs to be prioritized, how the process of triage can be helped with these remote AI applications. And I'm sure the new generation is more equipped with the knowledge and with the discussions, with the brainstorming, we can figure out the areas where we could utilize these services to uh, the corners of the world where the new technology can help us in every phase to save time, to do the right things in the right time, and to have a team working together despite the distances we have, despite the constraints we have. We can utilize it to provide the cost-effective solutions. And lastly, my comment is, as I said, that the doctor is a small piece in all the ecosystem of health. So we have to strengthen our colleagues. We have to strengthen our voice by supporting each other, and also convincing the masses and the policymakers and governments and ministries to give proper attention to the areas like neurohealthcare, where the top 10 morbidities and mortalities are falling into uh, making people drag into the poverty cycle, making people go to disabilities and loss of years and burden or productivity to the society. Thank you. And last and most important is the new generation of medical students and the graduates and people who have emotional connectivity to the health issues. May it be from the technology side or the health itself. They should be motivated to come and join these campaigns, these processes, so to bring better changes for patient families and healthcare workers. Thank you.
Thank you, Dr. Atta. I agree with you on the note that doctor is just one aspect of the entire healthcare ecosystem, and we as a whole have to, be united and support each other in strengthening the existing system and making it better at each and every step. I request our audience to place their questions if you have any. If not, we can conclude this session in 5 minutes.
It would be interesting to know about the perspective. Dr. Lele joined the neurosurgical domain in neurocritical care. If he could share.
Yeah, my background is in anesthesiology and then neurocritical care. And so as a neuroanesthesiologist and a neurointensivist, that's been my passion to promote obviously brain health in all aspects of care delivery pathways and to maintain that continuum of critical care right from the injury all the way to rehabilitation and recovery. I think so. I think as you rightly mentioned, we are a very small part of the big puzzle, right? It takes a village. It takes a lot of people to get that, get this initiative, this collaborative, as well as this entire community of healthcare professionals that come together to care for the neurologically injured patient, neurosurgical patients, in the hospital and in the community. So I think commendable work that neuro healthcare in LMIC group is doing. I would say that in my experience, I think, and just to follow up on your comment about AI, I think AI is a great educational tool. I think from my perspective, I think that's something that we've seen this new generation adopt really, really well, better than in the past, especially for self-learning as long as we understand the pitfalls when it comes to using AI technology for education. But I think the next generation of this AI algorithms are getting better and better every day in terms of doing some medical research and for us. And so I would say that um, when I think about neurocritical care around the world, I think as you I think rightly mentioned, the policymakers as well as the getting the patient the immediate treatment they need for an acute neurosurgical emergency still is challenging around the world. Even in parts of the United States or in other high income countries as well, we see that from time to time. And so I think we still have a long way to go. We still want to continue promoting that time is brain, initiative all along. And EVD is a very small, piece of the larger puzzle. But I think it starts with kind of getting this community together, which I think this organization has really done extremely well. And so really thank you for having me be part of this webinar. So
Thank you.
Dr. Atta, Dr. Lele, thank you for your wonderful presentations. I strongly believe your work will inspire our junior doctors, the next generation, and we will have a lot of impactful work coming up with strong collaborations and future work together. Thank you for being part of this initiative and contributing to this webinar series as the first of its kind. And we look forward to work with you in the times to come in. Thank you once again.
Thank you.
thank you.
Thank you.
Please connect with me via email for any questions, collaboration, any help I can provide on my end. Please, I'm here to support everyone. So.
Thank you, sir. Yes, we will be sharing your email addresses and official website links to our network with the summary of this webinar series.
Great. Thank you.
Great work, Dr. Bhatti, and
Thank you. Thank you, sir.
thank you.
Thank you. Great.